Hello everyone, and on behalf of WorkUp, I would like to welcome you to Connecting with Evidence in Practice, a Spark webinar. My name is Teresa Kellett, and I'm a Senior Project Officer for WorkUp, employed by ANROS. I would like to begin today by acknowledging that this forum is being broadcast from unceded Yagara and Turrbal land, and pay my respects to their elders past and present. Wherever we are joining from today, we are on unceded Aboriginal and Torres Strait Islander land, and I also acknowledge and pay respect to Aboriginal and Torres Strait Islander people participating in this session. Today we will have the privilege of hearing from a range of experts, all sharing their experiences, translating knowledge, implementing evidence, and evaluating outcomes. Each of our experts will give a short presentation. We will then open the discussion for questions from the audience. Questions and comments can be submitted via the Q&A function at any time. We encourage you to submit your questions at any stage during the webinar. This webinar will be recorded and made available on the WorkUp website as soon as possible. You can subscribe to the WorkUp e-newsletter and be notified when this is available. There is a QR code on your screen now that you can use to navigate to the WorkUp website. Speaking about gendered violence and systemic forms of discrimination can be confronting and distressing. It is important to take care of yourself while watching this webinar and after. If you would like to access support, please contact one of the services that are on your screen now. 1-800-RESPECT, 1-800-737-732, the Men's Referral Service on 1300-766-491, Lifeline on 13 11 14, or the First Nations Crisis Support Line 13-YARN. Spark webinars are an opportunity to connect with practitioners with current research, promoting knowledge sharing across the sector, and creating space for reflecting, thinking, and talking about practice. In today's webinar, we'll be tackling a challenge that we often hear about from practitioners. How can we, working in the busy and resource-poor environments that we do, maintain knowledge of recent and emerging research? And when we do hear about it, what can we do to incorporate new knowledge into our practice? This is a complex issue. To navigate our way through, we'll be hearing from a range of experts, all coming at our central theme from different perspectives. It is my pleasure to introduce the panel to you now. Michelle Robinson has been the Director, Evidence to Action at ANROS since 2017. With more than 20 years of experience applying research in practice and providing strategic advice, Michelle is going to talk to us about ANRO's approach to knowledge translation work. Marg Stott is a registered psychologist and is the National Practice, Implementation and Development Advisor at Auschchild. She has extensive experience working with services across Australia, implementing evidence-informed practice, and will be sharing what she has learned with us today. Professor Silke Meyer is a Lenin Ford Chair in the School of Health Sciences and Social Work at Griffith University. Silke has a wealth of knowledge to share, and today will share what she has learned from her years doing evaluation work with practitioner. Dr. Chez Leggatt-Cook is the Research and Knowledge Translation Manager in the Family and Disability section of Uniting Care. Chez's role is to facilitate research and evaluation across a wide range of programs, and she also helps staff to identify and implement evidence into practice, and she will help to ground our discussion in practice reality. Jacob Rynne is a Practice Improvement Advisor at Uniting Care, but he's also formerly a facilitator in the Men Choosing Change program at Uniting Care. The Men Choosing Change program has recently been the focus of an evidence implementation and evaluation project, and Jake will help us understand what participation looked like from his perspective as a practitioner at the time. What an impressive panel we have today. Welcome everyone. I am so glad you could all be here. Michelle, let's start with you. What can you tell us about ANRO's approach to knowledge translation?
Thanks, Teresa. Hi, everybody. As Teresa's introduced me, I'm Michelle Robinson, the Director of Evidence to Action at ANROS. It's a pleasure to be here with such an excellent panel today. I'd also like to acknowledge that wherever we are today, we are on unceded Aboriginal land. I'd like to pay my respects to elders past and present on this land, Meanjin, the land of the Yagara and Turrbal people. So today I'm going to talk about knowledge translation, what it is, how we do it at ANROS, and the way in which practitioners are integral to this process. Before I do that, I'll give a bit of an outline of what ANROS is. For those of you who aren't familiar with ANROS, it's Australia's national research organisation for women's safety. It's an initiative under the inaugural national plan to reduce violence against women and their children in 2010, and it continues under the current national plan. It was established by the Commonwealth and state and territory governments to produce, disseminate, and assist in applying evidence to policy and practice addressing violence against women and their children. So for more than a decade now, ANROS has created evidence to shift attitudes, support practice, influence reform, and affect lasting impact to ensure the safety of women and children. We lead the National Research Agenda and the National Community Attitude Survey, or the NCAS. We commission and produce evidence, and we provide evaluation services and expert consultation across everything related to domestic, family, and sexual violence. But it's really important to us that we don't just produce the evidence, we want people to use it. So the team I lead is the Evidence to Action team. We are tasked specifically with translating, disseminating, and promoting the uptake and application of evidence into practice and policy. What does this mean, you might ask? Well, we know that research and evidence is not accessible to everybody. It's not enough to produce a 300 rigorous, excellent piece of research and put it on a shelf, hoping that it might be read by practitioners, people like yourselves in the audience. Research is important, but this is really critically the only first step. And this is where we come in. That's why it's such a pleasure and an opportunity for me to be here today, because we'd love to hear back from you about what you find useful in terms of the resources that ANROS produces. So let's go to process, focusing on knowledge translation. So this is the act of taking evidence and contextualizing it so that practitioners and policymakers can use it to improve outcomes for families impacted by domestic, family, and sexual violence. There are many ways to do this, but what it relies on critically are people creating knowledge and people using knowledge, problem solving together and learning from one another. It's about making knowledge accessible and ready for application in practice. It's about creating the environment and the conditions in which knowledge and evidence can be understood and used in a practical way. And it's about that continual feedback loop to understand this. This means building trust and, more specifically, building, maintaining and promoting collaborative relationships between and with stakeholders. Critical to the relationship building is trust. If you don't trust what someone is saying, you aren't going to rely on it or use it. So it's building trust in the quality of the advice and the research, and in the quality and accessibility of the resources that translate it that is important. Quality speaks to the accuracy and integrity of the research, and the accessibility speaks to the availability, but also the way in which the resources can be applied or read or taken up. It's also making them in a format that is inclusive and reduces barriers. Everybody wants to know what works, and we're hearing that a lot at the moment, and they want it now. Timeliness of the evidence is also critical. There is absolutely no point in putting out outdated evidence that is of no use or not going to be of value in the time frame. So quality evidence is based on rigorous research, and that takes time. So this is an inherent tension in our work. How does ANROS manage this? Or how does anyone manage this? It's about influence. ANROS's approach to knowledge translation is focused on building relationships. On the screen, you can see our theory of change and how we hope to contribute to ending violence against women and children. At the centre, or the core of all the work, is influence, based on strong relationships. On the outside of the model are the 4 elements of our work. We listen to what practitioners are saying and experiencing, and we use that to inform our research and ground it in priorities that we've also taken on from the work that we do with both policymakers and practitioners. Practitioners and policymakers form part of our assessment panels when we are defining research priorities, when we are developing the ANRA, and also when we are looking at resources and how we produce them. And they are always tested through forums with practitioners in particular. We provide insights to inform the reform agenda of governments across jurisdictions. By way of example, some of these examples have been, and critical ones at the moment are coercive control and the policy brief that informed the conversations that many governments then had around whether or not to criminalise coercive control, which has been taken up in some jurisdictions. This was really important in terms of the developments, service developments in particular, around adolescent violence in the home, something that hadn't readily been understood in many jurisdictions as a separate form of violence, and which has now formed the basis of a research program that ANRO's ran out in 2022. And we're now finding that a lot of those findings are very important for practitioners, but also for policymakers in investing in appropriate services. And we also saw the importance of practitioners in the development of the MIS-ID research, and also the way in which that has been, how it underpins the training of police and the magistracy in terms of understanding who is the primary aggressor in a situation. We read and we think about new research evidence and consider who needs to hear this and how are we going to deliver these messages to them effectively. We do this for all of our stakeholders, including policymakers, our research organisations and practitioners, and that's who I'm going to focus on. In terms of the effective knowledge translation for ANRO's, it's about the nexus between content and influence. And this comes from the earlier comments I made around having quality resources and making them accessible, which is the content. But if it's going to be relied on and useful, influence with your stakeholders is critical. And that's where we see the algorithm, content and influence equals impact. And it's the relationships that develop and maintain this influence. These are really critical and we invest in them. There are both formal and informal channels, and there is a lot of internal work that occurs when there are with formal mechanisms, for example, such as advisory groups and bodies that we participate in. Talk, trust and time. This is a really important concept for knowledge translation. And it comes from the Canadian academic Nadine Wathen, who has informed a lot of the ANRO's knowledge translation work. ANRO's has developed an approach to knowledge translation that prioritises working together and valuing two-way learning. And talk, trust and time is the basis of that. You need to develop the relationships. There is a lot of talking. There is a lot of listening. This involves time and this develops trust. So that's where the very, very sort of basic concept comes from, the development of any relationship. So on the screen, you can see a diverse range of activities that the Evidence to Action team and the ANRO's group more fully has undertaken in their efforts to connect practitioners, yourselves, and all of the stakeholders with research insights. These activities have evolved over time, and we test and trial new things all the time, trying to reach as many people as possible. We seek to engage practitioners, as I said earlier, as early as possible in the research process to ensure that the research questions and project approaches are accurate and useful and relevant. We engage practitioners in the research process itself, and often this forms a basis of the guidelines for any grant that is commissioned and in our own research. And practitioners review and provide feedback on all of the resources that are produced by ANRO's. So more broadly, our connections with practitioners help us to identify emerging issues, spot trends, and shape our direction. We are seeking to strengthen these connections and the flow of knowledge, moving toward working more closely with domestic and family and sexual violence practitioners and their expertise without creating a burden for them. And this has been a really central tenet of the National Research Agenda. One of our more successful approaches has been by a workup, which I will talk about in greater detail later on. So in terms of our resources, I've just put on this, the screen, or Teresa has for me, a small selection of some of the resources that we've produced recently. These are all available on the ANROADS website on the resources page, and it is pretty full and can be a little bit difficult to navigate, but that's in hand. We are looking at how that becomes easier. We also host events, webinars like this one, and these have become a very popular and really accessible way for many practitioners to access new information. And we have an extensive catalogue, but the webinars are also a really important mechanism for our engagement with practitioners, because we build that network between practitioners and ourselves, and with between practitioner stakeholders themselves. We also host a conference every 2 years, and we've got one coming up. We also have an extensive range of resources that are just here. I'll just quickly run through them. So there are different, what I've tried to do is give you a taste of different types of resources. So the what works is the summary from the QATSIP research report summary. And we also have In Their Words, a service that meets my needs. It's a stakeholder kit for practitioners. The quick guide to the 2021 NCAS, findings for young Australians, Connecting the Dots, a really important practice framework for young people with disability experiencing domestic and family violence. And we found that that was really useful for practitioners, young people experiencing domestic and family violence and their families. The SD Practice resource, which is an evidence-based guideline to support the implementation of the Safe and Together approach. The Adolescent Family Violence in Australia Research Synthesis, which I referred to earlier, which has been incredibly successful and useful for both practitioners and policymakers making decisions about where to and how to develop new services and how to invest in them. And Chakra and a Lie Detector, which looked at Australians' mistrust in women's reports of sexual assault and the key messages from that report. What to look out for next? So we've got coming up new research on people who use violence and pathways into and out of violence. So this focus on interventions in perpetrator pathways is really important. Nationally, we've got new resources on research findings and recommendations on working at the intersections of alcohol and drug use, mental health, and domestic and family violence within families. New research on filicides following an identifiable history of intimate partner violence and child abuse, and new resources on actionable insights from ANROS's research on children and young people over the last 3 or 4 years, the research program I referred to earlier. So here's the QR code. We share information via our website, newsletter, and social media. So you can keep up to date with ANROS by subscribing to our newsletter and following us on social media. So WorkUp is a really important partnership, and it reflects the importance of our relationships. It's where the lead Healing Foundation is the lead partner with ANROS in setting up WorkUp. It's a workforce capability and capacity building service for Queensland practitioners. And on first glance, while WorkUp would not appear to be a natural fit for ANROS, what is important is that ANROS's role is to bridge the divide between research and practice in really meaningful and supported ways. So working with WorkUp to ensure that practitioners have access to evidence-based resources. So you can see on your screen a diagram explaining the 3 ways, or the 3 main ways, that WorkUp approaches their knowledge translation. The first column is about informing. So this is where we share information out to you. Activities like this webinar would be an example. The second is about supporting organisations to identify their evidence-based practice strengths and gaps. And the third is about implementation. And Marg is going to talk about that in further detail later on. So similar to ANROS, the WorkUp website also has a location for resources. And in this case, the resources are tailored to a Queensland audience, as I said earlier. So you can find the knowledge translation resources within the Develop the Workforce tile, which Teresa's showing up now. There is a growing body of resources there for you to access, and we'll continue to add to it over time. In fact, Teresa, I believe there's a new resource you're adding to accompany this webinar.
Yes, thanks, Michelle. So we are launching today a new suite of resources that are all focused on what is knowledge translation, what is evidence implementation, and the importance of evaluation. They're available today on the WorkUp website, and you can access them by that QR code on the screen there. So there's 3 very short fact sheets that just give a very brief overview of the topics. And then there is a series of reflective practice tools that you can use in your teams, in your supervision, and in other cases where you want to really think about what are you doing now and where could you go next. So have a look at those today.
So to wrap up, I think there are 3 main points that I wanted to conclude with. Reflective tools are really important, such as the questions contained in the resources. Having in place the right structures, including team structures, a theory of change, mechanisms for engaging stakeholders, such as regular formal meetings and informal mechanisms. Talk, trust, and time is also a very useful framing of the way in which we do this work.
Thanks, Michelle. So you mentioned there that there's a conference that ANROS has, right? So can you tell us anything about our upcoming conference and what might be happening?
I can. The upcoming ANROS conference is going to be held in late May next year. We're still finalising the specific dates. Again, it will be held online as we have in the last 2 conferences, but it'll be supported by face-to-face activities sitting around it. We're going to focus on children and young people and a lot of the service responses to adolescent violence in the home, but also to supporting young people experiencing domestic and family violence. We're going to look at ways in which the service sector, importantly, health, education, and the legal sector can support children and young people who are experiencing or using violence. And we're looking at it from a whole of families approach.
Brilliant. I can't wait for it. Thank you. We'll now turn to Marg, who is an expert in evidence implementation. Marg, you have extensive experience working with teams across Australia to implement evidence in practice. What have you learned?
Okay, well, thank you, Teresa. So as Teresa mentioned, I'm Marg and I'm a practice implementation and development advisor with Australind. So I'm going to take us through the next part of the webinar around the role of implementation science in practice. But before we do that, I'd like to respectfully acknowledge the Yuggera and the Turrbal people as the traditional custodians on whose land we are meeting on today. I would like to pay my respects to the elders past and present, and may the children of today lead us to a brighter tomorrow. So to frame things up a little, implementation science is the study of methods and strategies to promote the uptake of evidence-informed practices into business as usual, with the aim of improving overall service quality. Implementation practice tailors and applies these strategies to meet the needs of different communities and people to achieve positive outcomes, all while being adaptive and responsive to the different contexts in which we work. And it's implementation practice that I'm going to focus on in a little more detail in our webinar today. So hopefully you'll be able to take away some thoughts or ideas around how you can apply some of these strategies in your own contexts and practice settings. So why is implementation important? And very simply, children, young people and families don't benefit from what they don't receive. So we know that evidence-based programs and practices are necessary for good outcomes, but they're not enough. We need to think way more critically about how we implement them. So we can be using the best evidence-based program or practices in the world. However, if they're not being implemented as intended, it's unlikely that they're going to have an impact. So when you think about some of the big licensed manualised programs that are available, they all come with a pretty robust quality assurance framework that monitors how we go about implementing them. And that's for pretty good reason. I'm certainly not here to promote any particular program or practice. What I really want to focus on and what I really believe in is what's important here is to acknowledge the role of implementation, because we know that when programs and practices are implemented as intended, the children and families receiving them are more likely to benefit. On a side note, if you can count how many times I say implementation throughout this presentation, we'll try and organise a prize for you at the end. So how can implementation practice help? So we know that putting new practices or programs into place is challenging. And I think governments have been bought into the idea that evidence-based practice and programs are effective in helping to improve the lives of children and families. But I guess we're still working pretty hard to get them to buy into some of the evidence around implementation science and the important role that it plays to embed and sustain evidence into practice. So I think we've certainly come some way, but there's still some work to be done. So to do that, we need to focus on not just on the what, so not just on the evidence-based practice, but we also need to pay attention to the how, meaning the way in which we implement it. So let's spend a couple of minutes focusing on the how and why using an implementation framework can be of benefit. So you'll see on the slide there, you'll see an image of the AIF's Implementation in Action Guide, which is an implementation framework that was developed by some colleagues at CEI. So implementation frameworks explain, sorry, I've just lost my place there.
Happens to the best of us, Mark.
Implementation frameworks explain the different stages and activities you'll use when implementing a program or practice. They're kind of like a plan or a roadmap for the implementation process. And this is a great example of a framework that integrates relevant concepts that are common across many existing frameworks, but they're frequently used within the child and family service sector. So we know, and we've talked about already, that we need to be paying more attention to the how, and we can start by using an implementation framework. So within implementation frameworks are strategies that are designed to drive the implementation forward and to help overcome barriers as they arise. There are more than 70 implementation strategies that have been identified through research as effective to support high quality implementation. That is a lot. So they really are the how-to components of the implementation process. And in simple terms, these are the things that we know work. They also help practitioners to use the practices as they're intended. I think it's very fair to say that practitioners need more than just resources. We really need to be supporting them from within the organisation and the wider service system if they are to effectively embed evidence-based practices and programs into their business as usual. So let's take a closer look at some of the strategies. So let's start with champions. So champions are those individuals who believe in the program or practice, and so they dedicate themselves to supporting and driving that implementation process forward, especially in the face of resistance or barriers that can negatively influence that process. Champions exist within all levels of an organisation. In fact, it's really effective to have champions at both the leadership and practitioner level. A defining characteristic of a champion is their willingness to cultivate relationships internally and externally to support the implementation efforts because they believe so strongly in the innovation or the new practice that you're trying to implement. Let's take a look at implementation teams. So they oversee and monitor the activities that support and sustain those implementation efforts. So a good example of an implementation team would have expertise in the what, so someone there or people there with practice expertise, but also in the how it can best be adopted and embedded and sustained into a local context. These teams and these people are active and committed to working towards both operational and system change. One of the key strategies or things that we do in implementation teams is to really explore the barriers and enablers, so what's working well and what's getting in the way, by reviewing the data and using it to make informed decisions to help facilitate change. Implementations sit within a teaming structure, so there can be local implementation teams that sit within that local level of an organisation, and we'd want them to include leadership, practitioners and other key people in the organisation who play a key role. For example, your data experts are awesome members to have within your implementation team. It's also important if you're working within a wider system to have a central implementation team as well, as they serve as an accountability structure for effective implementation of the program. And they take on the leadership in decision-making and addressing implementation issues that are unable to be solved at that local level. Implementation plan. So as I mentioned before, I like to think about it as a roadmap that describes what the implementation strategies are that you're using, what stage of the implementation you're in, and how those strategies will be actioned, when you're going to do them, and also by whom. Training, pretty straightforward. We know that training is absolutely necessary, but it's not sufficient to embed practice into business as usual. Coaching is a minimum in terms of an effective strategy to capacity build practitioners' skills in a real world setting, and I'll talk about more about this one coming up next. Data for continuous quality improvement. So we want to use data to improve the quality and effectiveness of the implementation. And it's really important to monitor implementation quality as well as client outcomes. We really want to, I guess an example of this could be monitoring or having a look at frequency data. So are we actually using the practices that we're hoping to? Because again, as we talked about earlier, families can't benefit from something that they don't receive. And an example of that could be that not that the practitioners don't want to use that particular practice, but perhaps the training wasn't very good, or perhaps there's not good enough resources or easily accessible enough for practitioners to get a hold of. So using that data is really important information. And you can do this within the local implementation team setting in both a quantitative and qualitative way. So this is really just a snapshot of some of the best bet strategies that support high quality implementation, and they play a critical role in helping you to embed those new programs or practices into your work. As I mentioned, there are more than 70 strategies, and there are others that can and should be selected upon, depending upon your local context and the barriers that are being presented. Another important thing to consider is that we really need to be flexible. Not all strategies are going to work in all settings. So we want to make sure we're choosing the strategies that are most appropriate and really focusing on the local context to making sure they're fit for purpose to enable you to do the work effectively. All right, so coaching. So we know, as I mentioned, training is necessary, but it's not sufficient. And coaching really is a minimum in terms of an effective strategy to help build practitioners' skills within a real world setting. So coaching can be provided individually or as a group, and it's tailored to practitioner skills. So there's benefits of both approaches. Individual, of course, allows for more targeted skill development to that person. And it doesn't need to be pitched at a broader level to meet the needs of a whole team, where there's likely a various range of skills and experience. Group coaching, on the other hand, enables peer learning, consistency in practice approaches. It provides a shared experience for practitioners and also for conversations to continue outside of a coaching session. Importantly, both can be tailored to local context. Coaching also involves feedback and discussion, and these strategies also work to increase implementation fidelity and for programs to be delivered as they're intended. So as we know, evidence into practice is not just about what published research says works. For example, we know the research evidence doesn't capture practice wisdom or cultural practice and ways of knowing and working. It's also about practitioners' experience and skills and families' needs and preferences. Importantly, cultural expertise and Aboriginal ways of knowing and doing, and the importance, again, of local context and being flexible and adaptive in a real world setting. And just as we head into wrapping up on my sections, I've been very lucky to work across many regions in Australia, including remote communities in the Gulf, including Mount Isa and Southeast Queensland, and also in metropolitan regions. And I guess it was hard to sort of narrow this down to 4 things, but I did my best. And as Michelle has talked about earlier, just really want to reinforce the importance of engagement and relationships. So they are absolutely foundational to gaining buy-in at all levels, and they need to be maintained to support high quality implementation. So we can think about that as practitioners within a context with the people and the families that we serve, but I also think within our own organisations, with our peers, but also with our external stakeholders as well. So I think just really, really important. Context, as I've probably mentioned quite a bit throughout, is absolutely key when it comes to implementation success. So we really want to encourage people that are leading implementations to go at the pace of the agency where they're implementing the new innovation or new program. It's really important about meeting people where they're at. So this might mean moving faster or slower through a process of implementation that, you know, what you might read about. It may also mean moving back and forth between those implementation stages to revisit an earlier activity or to reinforce some particular skills or learning. Data-driven decision-making, I've talked briefly about that, and I think Silk is going to reinforce this message coming up next. And then finally, I think it's really important again this links back to what Michelle was saying and about the engagement and relationships as well, is that systems don't change, people do. And from the words of a caregiver who provided some feedback recently on an implementation that I was involved in, was that teamwork makes the dream work. And I think, Teresa, you can probably talk to a little bit about some of your learnings around that as well.
Yes, I was very lucky to work with Marg for a couple of years doing implementation work in Queensland and in Victoria and other places. And now in my role at WorkUp, I do have the opportunity to continue that work, and I'm actually able to support our target group to develop and implement implementation projects. And if you are in our target group, which is the domestic and family violence, sexual violence, and women's health and wellbeing workforce in Queensland, and you're interested in doing something like that, you can reach out to me and we can start a conversation. Now, my colleague Chris is going to put my email address in the chat, but I have heard that she is having some trouble accessing the chat. So there will be an email address at the end if it's not showing up just now. She also reminded me to let you guys know that the slides from today will actually be made available. So if the slides have gone past too fast and you haven't quite caught a point that you're hoping to, you will have access to those after the talk today. So we've talked today about knowledge translation and we've talked about implementation. So the next logical question is, how do we know that it works? So Professor Meyer, you have a lot of experience delivering evaluations with practitioners. What can you tell us about that?
Thanks, Teresa. Thanks for the introduction and the opportunity to be part of this webinar today. As Teresa said, my name is Silke Meyer. I'm currently in the position of the leaning for Chair in Child and Family Research, which is a joint appointment between the Queensland Department of Child Safety and Griffith University, with a specific focus on knowledge translation between researchers and research organisations and the practice space in the broader child protection world. I'm also a social worker and criminologist by training, with practice experience in intensive family support services and the youth justice space. And before I start talking about evaluation research and evidence creation, I also want to acknowledge the traditional custodians of the various lands from which we're presenting and others are listening today, the Yagara and the Turrbal people here in Mianjin, and recognize that this land always has been, always will be Aboriginal land. So I will be talking a little bit about why evaluation is important, and my evaluation experience and research experience working with different organizations and working with practitioners in the design and implementation of evaluation research. I will also talk a little bit about what practitioners or organizations can do when, as Teresa acknowledged in the beginning, when funds are limited in a in a service landscape that is very often resource scarce or under-resourced, and put up some resources linking back to some of the resources available that Michelle has already talked about, but also some broader resources around what you as practitioners or organizational managers can do in terms of preparing for evaluation research, supporting the planning and the implementation of evidence creation. So in terms of why evaluation research is important, or why program evaluations are important, I guess there's a few obvious or more obvious reasons, and a few maybe less obvious reasons. I think one of the main things often is that we need some sort of evidence of impact for either funding applications for future continuation or rollout of different kind of programs, or maybe to apply for funding in the first place, demonstrating to funders how programs that are being funded are being implemented. I guess going back to what Mark already talked about in terms of the implementation and whether programs are implemented the way they're meant to, whether programs require some adjustment depending on, we have a lot of, I guess, high-level program designs, but that doesn't necessarily mean that there's a one-size-fits-all to program implementation, and not every program works in the same format for diverse populations of service users, for example. I guess it's also important to know your impact, even if it's not for the purpose of demonstrating to a funding body, for example, what the impact is, but understanding, and I think particularly in the domestic, family and sexual violence space, but also in the child and family welfare space and other social work spaces, the vast majority, if not all practitioners, are passionate about the work that we do in that place. And I think it's valuable for practitioners, and it's reinforcing for practitioners who, provide a lot of their practice and personal resources into the work they do, to know whether their work makes a difference. And if it does make a difference, how does it make a difference? And if it's not making a difference for certain service users or cohorts of service users, what can we do to tweak that, for example? So identifying some of the gaps in what currently works, or what works for whom, or what doesn't work for some populations, to really inform future, I guess, going back to the implementation, future directions for implementation, for adaptations of different programs, to make sure they're fit for purpose and fit for the target populations that we're working with. And then I guess, one of the things is that there are often or always annual performance reports, and while they may not require detailed evaluation evidence, they will require some evidence of implementation and impact of the work that you do. So moving on to some of the key learnings, I guess, that I've taken away from having worked with practitioners across a number of different program evaluations in the domestic and family violence space, particularly in the men's intervention space, but also child and family welfare space, and the support work for victim survivors affected by domestic and family and sexual violence. I think one of the great benefits is where you have evaluations that you can engage in from the beginning, and you can really be part of the design and implementation of the evaluation research. I think it creates a sense of purpose from the beginning for everyone involved. And I think it brings together the expertise of evaluation researchers who kind of have a sound understanding of evaluation design, and equally the practice wisdom and the practice expertise and experience of practitioners who know what things look like on the ground, and what some of the key questions are around current implementation, evidence creation, and future directions. I think it's also often, I guess, an eye-opener or a learning for practitioners from different program areas of what the different program areas actually do, how it's done, and what impact those different program areas see. So, for example, if we stick with the men's behavior space, men's behavior change space, I think we often think about the group-based work with men, but we also know that men's behavior change programs are designed to make the lives of women and children, victim survivors, safer. So we always have a component of a family safety worker component, or victim or women's advocate service component. Sometimes also, depending on how large and well-resourced different services are, maybe a child advocacy component, or at least some sort of child counseling and child-centered work in the service space. And I often find evaluations can be the first point where really, while everybody knows what kind of service areas exist, those conversations and the transparency and the emerging findings of what these areas actually do, how they do it, and what kind of impact they observe across their practice areas. I think the other learning often is when we have the opportunity to bring together the internal practice evidence of programs, program facilitators, for example, women's advocates, program managers, and then the external stakeholders that usually form part of any programs, going back to what Mark talked about, the service landscape, including in the child and family welfare space, when we're rarely, if ever, talking about an individual isolated service or program. We're talking about an intervention or program that takes place within a wider service landscape, ideally in an integrated sense, and really bringing together the practitioner wisdom across the different partner agencies to create an understanding of what programs are delivering, what different program components can deliver, what the limitations, the scope, and the opportunities are, and equally a shared understanding from programs and program practitioners of what the wider service landscape does. And I think this is often particularly interesting and eye-opening around information exchange and the expectations of different kind of partner agencies of what should be possible and what actually can be possible, and really creating those transparent conversations and understanding of the integration of a program into the wider service area. And then I think going back to the understanding across different program areas, really being able to see the impact of your work beyond your direct work with clients. So I think program facilitators, for example, usually have a good understanding of what kind of impact they have or can create in a room with men. The women's advocates have a good understanding of the impact or the difference they may make to women's lives in the family safety context. And while there's some information exchange, I think unless it is around risk monitoring and management, for example, there is not necessarily information exchange around what kind of difference people observe and whether things work and what that might look like. Whether a program works, for example, for a man who uses violence may look different for the woman and the children affected by men's use of violence, or women and children's experiences of men's behavior change may be more nuanced than what we sometimes look at in administrative data, for example, to see whether he's come back to the attention of police interventions, DVO breaches, court responses, criminal charges, for example. And then I think, of course, really hearing the voices of service users and the diverse groups of service users that are involved in service delivery. So I think, again, when we talk about men's behavior change programs, really the importance of not just having the voices of the direct target population that's being catered for in a room, in a group-based intervention, but also the voices of victim survivors, adult victim survivors, and where possible, child victim survivors that are affected by men's use of violence. And I think a lot of the value for practitioners goes back to really validating what we often refer to as anecdotal evidence. I think practitioners have a lot of knowledge, wisdom, and expertise, and often have a very good sense of what's working, what's not working, and how things are working. But when they talk about it in the wider system, they're very often brushed off as, that's just anecdotal evidence, unless you've actually evaluated this and you've got some research evidence to sit alongside that. It's really just anecdotal evidence. I think it's often very powerful for practitioners to realize what I think I know and what my gut feeling is, what kind of difference my work makes is actually true when we look at the research evidence of it. So just touching on the what can you do when funds are limited, and I think I want to start with the last point on my slides here, that really funds shouldn't be limited. And I think this is a sticking point for me in the program implementation space, that we very often see funding bodies, primarily government departments as funding bodies, funding interventions, new interventions, pilot interventions, adaptations of existing interventions without funding a research evaluation component to it. And then at the back end of the intervention timeframe, asking the program providers for evidence of how it went, whether it makes any difference in order to acquire any future funding, extension, adaptation, or rollout of a program. But I guess sticking with the reality that we know the sector is under-resourced, and very often programs are funded and there may not be evaluation funding attached to it, there are opportunities to, I guess, prepare for evaluations. By creating your own database in terms of collecting basic data on program or service users, program participants, and equally on the victim survivors that engage with the family safety component of men's behavior change programs, for example. If you have the opportunity and you know that eventually you will be coming up to an evaluation or you will want to do an evaluation, it's quite valuable thinking about collecting data over time. So starting creating a database early on and having the opportunity to collect data from program participants and attached affected family members over time. I think the other thing, and on my final slides, there's some suggested resources, but I think if you search in your relevant jurisdictions from the government departments, usually there's a number of guides and resources available on planning evaluations, mapping evaluation work, implementing evaluations, whether it's in preparation for someone else doing the work or whether it's in preparation for your own implementation of an evaluation. I think the other opportunity always is reaching out to your local universities. And I think particularly researchers in social work and criminology, for example, we often have placement students who do research placements, for example, or social work placements with a research component. Summer internships for students, undergraduate students who may be able to assist with some of the data entry, data collection, building a database. But also reaching out to universities and some of the academics in the domestic and family violence space, particularly in the program evaluation space, having conversations and seeking some input on how you may prepare for an evaluation and at least a wider sense of what kind of data is useful to collect from the start. I think the other opportunity is to connect with other services because we know that services do evaluation work, sometimes their own internally funded evaluation work, sometimes externally funded evaluation work. But connecting with other program providers and services to learn from their own experience with evaluation research to, I guess, kind of benefit from existing knowledge, but also from some of the hurdles that others had to overcome and maybe some of the mistakes others have learned from during the planning and implementation process. So on the final slides, and as Teresa said, they will be made available. I think I want to point in particular, if we're talking about program evaluations in the domestic family sexual violence intervention space and men's behavior space, to the ENROLS portal, because there are a number of resources that are specifically tailored to this space in terms of guides for evaluation preparation and evaluation implementation, but then also, as I said, other resources where, for example, New South Wales and Queensland governments have evaluation guides and evaluation planning and implementation guides, for example. Thank you.
Thanks, Silky. I was just reflecting as you were talking that was how I got into the sector as a research project as a student in my final year of my degree. So yes, students can be useful sometimes too. Those resources that were on the screen just there, yes, will be accessible through the PowerPoints that we'll be sharing. We've also set up a page on the Work Up Queensland website on the knowledge translation page that has connecting with evidence resources, and there's a lot of similar resources like the ACE guide that we were talking about, and some other useful resources that have been specifically designed for practitioner use there. So I do encourage you to check those out. So I'd now like to turn to our final two speakers from Uniting Care. Jacob and Chez have been doing this work in practice. So it's all very good and well to talk theory and what you should do and what you could do, but now we get to hear a real life case example from people who've actually worked through it from start to finish. So please share what you've done.
Thanks, Teresa, and thank you so much for the opportunity to be here today and to talk about the work that we've been doing. I'd like to recognise the acknowledgements that everyone on the panel has provided today, and also provide our own acknowledgement to the traditional owners of the lands on which we're connecting in from today, and pay my respect to elders past, present and emerging. So just a bit of background about Uniting Care. So we're one of the largest providers of men's behaviour change programs in Queensland, and we've been doing this work for over 15 years now. Our core program is Men Choosing Change, which we deliver in Ipswich, Moreton Bay, Sunshine Coast, Fraser Coast and Mackay. A few years ago, we decided to evaluate Men Choosing Change, and we wanted to do something as robust as possible in the hope of being able to contribute to the evidence base. And we also wanted to understand how we could improve the support that we provide to men, women and children in the program. So up on the screen now, I have got a timeline, and I wanted to put this on the first slide to really demonstrate just how long we have been doing this work. It certainly does not happen overnight. So we started back in 2018 by forming a partnership with the Queensland Centre for Domestic and Family Violence Research at Central Queensland University. And we were very, very lucky to have Professor Annabelle Taylor and Dr. Sue Carswell walking alongside us for the evaluation. So we kicked off the project with co-design, and as some of the others have spoken about, that early engagement of staff and developing that collaborative approach to evaluation that takes everyone on the journey, I think is just so important for future program improvement. So Annabelle and Sue ran 4 theory of change workshops in various locations, and that enabled all of our staff and quite a few of our external stakeholders to be involved in developing the theory of change and thinking about outcomes. Out of that, the evaluation framework and methodology was finalised. In 2019, we were ready to start collecting data. So Annabelle and Sue were using interviews and surveys with men and women to understand the immediate impact of the program for the safety of women and children and the behaviours and attitudes of men. They also interviewed most of our staff and external stakeholders at that time to really understand how the program had been implemented and what those service delivery challenges were. Then COVID came along, and things got a bit complicated and we had quite a few delays. But we eventually got our first report out towards the end of 2020. Then in 2021, we decided that we needed to have our first attempt of going back to our staff and engaging them in the findings and thinking about how we might respond to some of that evidence. So to do that, we held 3 workshops. They were all online because COVID. But it enabled all of our staff right across the state to participate. And it was really apparent at that stage that the early co-design was paying off because staff could see that their voices had been heard and the findings reflected what they were experiencing in practice. The workshops were a lot of fun, and the staff had so many fantastic ideas about what needed to change in our program, but also within the broader system. And we were able to action a few things. One of the ideas was a big idea, which was to pilot a behaviour maintenance program for men who wanted to continue working on their journey towards non-violence. So that was a significant action. But to be very honest, most of the ideas that we came up with during those workshops were just too big. You know, they felt out of reach and they didn't really go anywhere. So through that time, Annabelle and Sue were still continuing with the evaluation, and they were following up with men and women to see how they were tracking over a longer period of time. So when our second report came out in 2022, we decided that we needed to have another go at engaging staff and implementing some evidence. So this time we were able to do it face-to-face. We had all of our staff together for 2 days. including our external women's advocates. And for a lot of our staff, this was the first time that they were actually meeting each other in person. And we also knew that we needed to have a much clearer process for grounding our ideas and making sure that they were practical and achievable. Excellent. Thank you. Okay, so we changed our process to be a lot more structured. We were informed by a lot of ideas from implementation science, which was very new to us at the time and still feels quite new. So we still had time for brainstorming in our process, but it was contained and we had much more focus on facilitated discussion and working together to achieve consensus about what we should prioritise. So the first step was to hear the research findings. The second step was to identify the opportunities for change. And during that part, we kept reminding staff to think about what was practical to change within our current resources. So that really became our reality check to make sure that everything was going to be achievable. In step 3, we asked staff to reflect on the ideas they had generated and to think about which ones were most urgently needed. And in that photograph, you can see a lot of our ideas for how to improve support for women and children in the program, which primarily happens through the Women's Advocate role. And there were a couple of ideas that really stood out as urgent from that mix. So I'm just going to demonstrate that one a little bit for you. So if I go back to the evaluation, we found that when an advocate connected with a woman whose partner was participating in our program or ex-partner, it was often the first time that that woman had been connected in with formal supports. So it was a really good opportunity to provide some support for her and the children. Most of the women who worked with the advocate found this support to be really helpful, but a lot of women were saying that they really wanted more support over a longer period of time or a different sort of support. The advocates themselves were really struggling to keep up with the demand and to provide all of the support that was needed. And this was largely a reflection of the limited resourcing for the role. And that wasn't something that we could change, or certainly not in the short term. The advocates were also expressing that they felt quite isolated in their roles and they wanted more opportunity to connect with each other and to share ideas for how to do this really challenging work. So at the forum, all of us talked a lot about how can we bring more focus to this role, because it's such a critical role for maintaining safety within the program. And one of the ideas that we settled on was to develop a specific practice manual, especially for the advocate role. Like we had one for the facilitators, but we didn't have one for the advocates. And the purpose of that was to help align practices, processes, resources, and ideas for working across each location. So I just want to say that, you know, developing a practice manual, that isn't something kind of that nobody would have ever thought of before. You know, it's not rocket science, but it was a gap that had been identified and it was what we needed. And there was also a lot of value in the discussion that we all had and the process of collectively developing a better understanding of the role and what was needed to make that work a success. So that part was really critical for identifying what we were going to do. Step 4 was about planning the change. And at that point, we introduced the idea of a quality improvement project, or a QIP, as we call them at Uniting Care. And that's a project that has a clearly defined deliverable, like a manual in this instance, and is time limited. So it's got a very clear start and end point, and it's definitely not a BAU. We asked our staff to nominate themselves to be on the working group, or, you know, become an implementation team, as Marg was speaking about before. So all of the advocates wanted to be part of this project, and one of the frontline managers was nominated to be the champion for the group. And this group then sat together around a table to plan out the project. Thanks. To help them do the action planning, we created a tool that we call the Roadmap for Change. It's not a new tool. We've based it very heavily on Melanie Barwick's implementation roadmap, which was developed at the Sick Kids Institute in Canada. It's a really fantastic tool, and we really haven't done anything to the concepts. It's just the presentation. So it was presented as quite a clinical tool, and it didn't, you know, fit so well with our context. So Elliot Bryan, who was a research officer in our team with some really great creative skills, he really reinterpreted the tool and to make it more Uniting Care friendly. It's essentially an action planning tool that helps you step out the problem that you want to address and the specific actions that you need to do to get there. And we printed it out on poster-sized sheets of paper, which you can see in the photograph there. And we had lots of sensory items like Lego and Play-Doh to encourage a sense of creativity and playfulness alongside the hard work of planning. So I'm now going to hand you over to Jake, and he's going to tell you a little bit more about how this all worked.
Thank you very much, Chez, and thank you to the rest of the panel. I feel very honoured to be here with all of you. So this is just a slide that kind of covers some of the main findings, certainly not all of the findings that came out of the evaluation, but in particular, some of the findings that probably landed pretty heavily for facilitators and women's advocates and people doing the work. So we'll start at the top. There is a need for a stronger focus on the advocate role and support for women's advocates. So I think if you speak to anyone in the industry doing the work, they will say exactly that. As a facilitator, I might have had 15 or 20 clients on my roster. We had 5 facilitators who all had the same number and 1 women's advocate. So that means she was 200, 300, 400 clients on her roster that she was kind of responsible for making contact with and all those things. So we developed the WA practice manual to show that we are putting a focus on what needs to be done and to align everyone going on there. And create regular opportunities for cross-location contact. I think that was also very vital and something that's been called for a very long time. Facilitators, we get to chat with each other and our co-facilitator and everything like that after group and debrief. We can't necessarily always do that with a women's advocate because there are information sharing restrictions and we don't know everything about their clients, they don't know everything about ours, and they feel isolated if they're sitting next to you at the desk next to you. So for them to be able to connect across the state was a really big deal that I just, speaking to some of the women's advocates, made a huge change in, their coming to work and how they felt. Again, the need for a focus on children is, again, something that is said all the time, but costs a lot of resources. So we could only do so much within the limit that we have. So that was kind of like updating documents and really having more conversations about kids and the impact that might be going on there. Intake processes were another difficult one to change because we have an obligation to be helping certain people, but a lot of facilitators also push back and say, maybe he's not ready, or maybe he's not showing enough accountability to come through. And trying to align that across multiple practitioners and sites and managers across the state is really difficult. And even just coming up with this is kind of our intake process and our standards for getting in is really hard because everyone has different opinions. And even that can change day to day, depending on, where you're at yourself as a facilitator those days. The Men's Sustain Change program is, again, you hear all the time, our program runs for 16 weeks. You have a guy come to the end, can I do the program again? Or is there somewhere else that I can be going? Or even as facilitators, we're going, I think he needs a bit longer. We just need to keep eyes on him, have some contact, and we feel like we can really make a change there. But his funding is coming to an end and his time with us is coming to an end. So it was one that had been pushed for, I think, across the industry quite a bit, but it was really great to see it come out of our research and our programs and our evaluation that we could evidence the need for that in a more direct way. And then the review of the facilitator manual. So it was kind of up for review anyway. It was a few years old and the timing lined up really nicely. So we needed to do a review of that a few months after we got the evaluation findings. So it really helped us kind of push through and implement those findings as soon as we possibly could. So the impact on the frontline staff. So kind of just speaking from my own perspective here, weren't really shocked too much by what came out of the evaluation. It all kind of aligned with what we were already talking about, which is probably a good thing. That means the evaluation is finding the same things that the people who do the work see every day. It gave valuable perspective on how the men and women define successful engagement. So when you are working with the men each day, or you're making those calls as a women's advocate, you get a sense of, am I actually making a difference? And you focus all the time on the difficult cases, the ones where there's a lot of risk. And even there, you start to wonder, is that just all I see? Is there no change going on there? So to actually read from people, this is what success looked like. And it doesn't mean all the violence went away even, but it does mean I felt safer here, or it does mean my kids were able to go to school and feel okay that day. And that's the type of wins that I think facilitators know that they are working towards. Involving the staff in the continuous improvement process was a big change. So historically, the managers had always been involved, but like we said, at this big forum that we had, it was the first time many of us met each other. And it was really good to bring in the whole program there instead of just managers. And I think it helped keep the momentum up that might have otherwise just stopped after that meeting there. And then the working groups, the QIPs, as Chez mentioned before, were kind of the assurance that we would continue on and really make a difference in implementing those sort of things there. So yeah, as Mark said, we had a couple of champions who put their hands up to be the people to implement that. And they were, frontline staff, managers, a whole range of people that kind of got to pick the one that was their passion project within the program. Some continued changes. So leadership providing resources and giving agency to the program to enact the change. It wasn't as if Chez came in and said, this is what your program has to look like now. It wasn't as if the managers said, we need to change everything because the evaluation has said this is what we need to do. It was, these are the findings. You guys do the work. How can you improve your practice based on that? The findings were presented with actionable recommendations. So even I'm just remembering the slide that Chez came through. You can read the whole evaluation. It's long and steep. Most people don't have time for that. The slides just had, this is what we're recommending out of that. And I think it lined up almost perfectly with what a lot of facilitators were feeling at the time. I will mention the challenge of a bit of the time burden that it felt like for the frontline staff there. We have a KPI where we need to have a certain number of contact hours each day, and we're probably already close to burnout at the best of times anyway. To add some extra things on top is hard. And it really only got across the line because I think we have such a passionate team who was willing to put a little bit extra than the bare minimum in those standards there. Changes achieved. So we redesigned the group work modules. So as Chez said, we have many sites across the states. We brought them all under the one banner, the same process, the same topics and everything like that, which will hopefully improve our ability to be evaluated in the future too, because there'll be a bit more alignment between that. But also aligned all the teams underneath the same practice. When we're talking across the state, we have a shared language and things like that now as well. The continued advocacy for men sustaining change program was also vitally important. It was also an introduction for a lot of the frontline staff to the program. We kind of heard whispers about it and things like that before. We got to actually have a chat to some of the people working in the program and see how that was going. And then the creation of a specific manual for the women's advocates. So yeah, they had always been the afterthought. And the fact that they got their own manual was almost a show of consideration from the program that you're not an afterthought now, you are a primary thought. And yeah, the changes to documentation, everything else came out after that too. So I'll pass you back.
Thanks, Jake. So just a couple of final comments. I think that there was some really clear benefits for practice in terms of doing the evaluation and then working with all of the staff to identify and implement changes. But there were some benefits for Uniting Care as well. So in terms of the evaluation, it really helped us to advocate for why we should go ahead and pilot that new Men Sustaining Change program and evaluate that. And we were eventually able to secure additional funding for that program, which is great. But the other really broad impact that I think we're really seeing now is that this whole evaluation, which is still the first time that we've done an end-to-end process from evaluation through to continuous improvement, it really demonstrated to Uniting Care that this can work. This really can strengthen our programs. Yes, it takes a long time. Yes, it feels like something extra, but at the end of the day, it does add up to a stronger program and improved outcomes for our clients. So I think I'll leave it there, Teresa.
Thank you so much. This is such an impressive project. I got to hear about it late last year, early this year, when you reached out to share the good work that you'd been doing. And that led us to start to have some conversations about what can we do with this information? How can we spread that knowledge, even further? So we've started amongst ourselves a conversation about potentially having an event or some sort of activity where we can bring particularly the men's behaviour change space together and share knowledge and build on each other's knowledge. So if that sounds like something you'd like to be interested in, you can definitely reach out to me and we will continue to work on that project. We're looking at doing something at the end of the year. So keep your eyes out for that one. So we are going to open up the discussion for questions now. So if you haven't already, but you've got one in your mind and you want to pass through a question via the Q&A prompt in your Zoom, we will do that now. And I have a couple. So Silky, we've got a question here for you. How can we promote or give more credibility to sector wisdom as a valid evidence base?
Such a good question.
And if anyone else wants to jump in, go for it.
Look, I don't think I've come to another solution other than engaging with research that, seems to be at least what funding bodies tend to draw on in terms of what does the evidence say. I think there's certainly opportunities, and I think as evidenced by the Uniting Care example, of really having a collaborative approach to evidence creation and co-design. And really, I think, and that goes to researchers more than practitioners, to engaging with practitioners and practitioner wisdom from the get-go, because usually practitioners are the ones who know how things are working. They have a sense of what's working, what's not working, what are some of the key questions, what are some of the key gaps or populations, for example, that were missing, where are we doing well, where are we doing not so well, to really incorporate that into any evaluation work, rather than just being externally guided by what researchers may think are core questions around program effectiveness, for example.
Yeah. And Michelle, the new National Research Agenda incorporates different ways of knowing and understanding evidence.
It does indeed, Teresa, and practice wisdom and the engagement and co-design of services in the both the research phase and the delivery phase of any outcome is included in that. And I think I guess the other thing I'd speak to is the inclusion of that as a condition of any grant funding. And I know that the recent call that ANROS has just finalised included the inclusion of a service delivery arm in the research grant proposal. And I think if we look at how ARC and NHMRC are developing their guidelines and advocating for the inclusion of services to be included as research partners.
I'll keep the microphone with you, Michelle, because there's another one here. And it's the golden question that we always get asked. So we have so much evidence and information, and there's so much people doing work in this space. Why are we still seeing increases in the DFV stats? Why are we still seeing more evidence of domestic violence out there? Go on, I dare you to answer that.
I'll begin this, but I'm sure everyone has a different perspective. I think in the first instance, we are talking about it more. We are hearing about it more. It's being reported. We are engaging in and with lived experience and survivor advocates. So that, to me, lends itself to it being opened up in a way that we can then develop and enhance the service response. And I think that's where the focus needs to be. We can't just, it's like, I think recently I read, the difficulty in opening up and in creating a space and a voice for survivors is they're not having appropriate or adequate or sufficient services to respond. And that's where the energy needs to go.
Very true.
Would anyone else like to speak to that question?
Great.
And I feel like now I lost my trail of thought to respond to that.
Why is it still increasing, Silky? Why is it still increasing?
Oh, yes. Well, I think it's more of reporting, conversations, awareness. I think also recognition of victim survivors. And I mean, I think still, despite all the narrative we've had around diverse experiences or forms of domestic and family sexual violence, there's still, I think a lot of victim survivor realizations, as Chez said, sometimes in the men's behavior change space, it's the first time women are connected with that women's advocate component. And the first time women are having conversations where a specialist worker names the behaviors and assists victim survivors in identifying the more subtle and more nuanced and less obvious forms of domestic and family violence. I think we have a much better understanding, recognition, a breakdown of stigma of disclosing domestic and family violence. I think in terms of, why are we still trying to figure out what's working or creating more evidence? I think we know much more about what works for victim survivors than we know about what works for whom in terms of people using violence. And I think while it's important to know what works for victim survivors and having support mechanisms available, that's not the answer to ending domestic and family and sexual violence. The answer lies with the people using violence. So I think that's really where we need to get better at creating evidence, not just what works or saying, well, generally we don't really have broader evidence that this or that works, but rather what works and for whom and how does it work in a much more nuanced way. And I think in the going back to what Michelle was saying earlier around the next NRO's conversation around responding to young people using violence, really recognizing the opportunities of working with responding to children as victim survivors in their own right to break that intergenerational cycle of domestic, family and sexual violence.
Thanks, Silky. I'll get you to send the microphone the other way because I've got a question for Chez and Jacob here. So Shay's comments about some ideas being too big to implement is ringing very true for this commenter. Was it hard to pull back to achievable practical steps? What helped or made this possible?
Ooh, interesting question. Look, I think that like the initial brainstorming that we did in those initial online workshops there was a lot of enthusiasm in the room and people love to think big. You know, it's amazing to let your mind just think about if we could change anything that we wanted, what would that be? But I think at the end of the day, people felt like, well, that was a great time, but it was a bit of a talk fest. So I think a second time around, people were ready to work. They were actually ready to make some change informed by what we were doing. And so even though a lot of the ideas were kind of pulled back and they were smaller and more manageable, we actually did them. And I think that actually proved to everybody that we can actually do this work. Yes, it's challenging. And yes, we might need to modify our expectations, but we can do it.
Very true. Mark, leading on to that, so in addition to this idea of trying to do everything and these big, broad questions that we want to achieve, in your experience, what would you describe as the biggest barriers that practitioners face when it comes to implementing evidence-based programs or practices? What are the barriers?
If I had to pick one, and I've got lots of practitioner voices going around me, I would have to say it's, I can't pick one, sorry, I have to pick two. I would have to say low time, like feeling time pressured all the time. And so often there's the absolute want and the passion to do things differently. But when you don't have the time or space or the resources within an organisation to offer coaching, like, you know, we talked about how beneficial it is, but not everybody has the luxury of engaging in that. It's easy and natural to revert back to your original ways of doing things, which aren't necessarily bad by any means, but it's just not providing that opportunity to do things differently or to engage in really knowing what we know works.
You mentioned there was over 70 strategies that we know that works. Where would people go if they wanted to actually find those strategies and review them for themselves?
They could go to have a look at implementation science websites or the Centre for Evidence and Implementation, which also have great resources that you can connect to. I imagine they can probably go to NRO's as well to access a great range of implementation frameworks that include many different types of strategies and probably importantly ones that are fit for the service sector in which you're working in. But yeah, there's so many great resources out there. In fact, it can often be confusing. So perhaps NRO's is a great place to go for those.
Love that plug, Marg. Love it. Did you want to add to that at all, Michelle? Did you want to talk about the resources that people
They're
have?
definitely there. And one in particular that comes up is invisible practices. And I was reflecting on the manuals, the practice manuals that have been developed. So through a lot of the perpetrator intervention research program that we finalised in 2020, there are a number of practice manuals that are that have resulted from those, but even more recently from the focus on children and young people. And I'm thinking in particular of the one from QATSIP that Candice and Garth developed, and that's been a fabulous resource for the service sector
generally.
And if people want to know more about that project, they can look at one of our previous Spark webinars that we recorded last year on the topic. Jake, I'm going to give you the last question. So while the microphone makes its way down to you, could you think about this question? Would you do this again, knowing what you know now?
As in this webinar?
Sure, why not? This whole big project that took a lot of time and effort.
I would absolutely do it again. In fact, I wish I could do it again tomorrow because I learned so much from doing that process the first time that, yeah, I feel like if we could have another bite of it, we'd do an even better job. So absolutely, it is something that, yeah, it needs continuous improvement. And like the question before, why are we seeing more of it? Because society's attitudes of what domestic violence is changing, and our programs have to always change to kind of fit that as well and where the trends and stuff are. So yeah, absolutely. And then again, after that as well too.
Thank you. Well, thank you everyone for joining us. We've actually come to the end of our time for today. So I would like to extend a very warm thank you to our panelists for joining us today and sharing your knowledge and experience. And I'd also like to thank the attendees for your participation and very thoughtful question. So don't forget, those knowledge translation resources are available now on the WorkUp website. They are a great way to start this conversation in your teams. The recording from today will be made available on the WorkUp website as soon as possible for you to share with your colleagues. If you have any questions or comments about this webinar, please contact me at teresa.kellett@anrose.org.au. And if you enjoyed today's webinar, you might also be interested in some of our previous Sparks, including enhancing practice at the intersection of disability, violence and youth, listening to community to heal our children and young people, the one that Michelle was referring to, insights from the NCAS and the Personal Safety Survey, implications for primary prevention practice. And I encourage you to keep an eye out for our next Spark, which will be announced soon. All of the recordings and presentation slides from previous Sparks can be found on the resource hub of the WorkUp Queensland website or via the QR code that you can see on your screen right now. Today's recording will definitely be available soon. Stay connected with WorkUp via our website, our newsletter and our Facebook group. There are always more great WorkUp events to participate in, and you can see some of them on your screen right now. The QR code will take you through to our What's On page where you can register. I'm Teresa Kellett, and on behalf of WorkUp, thank you and goodbye.